Chapter 25, Survivors of Abuse and Neglect, Part 2. Children are vulnerable and relatively powerless. The effects of maltreatment are deep and long lasting. Child maltreatment typically includes physical or emotional injury, physical or emotional neglect, or sexual acts inflicted upon a child by a caregiver. So, physical abuse is any non accidental physical injury caused by parent or caregiver. Signs and symptoms include unexplained injuries, child is frightened of adults, child reports injury by parent or caregiver, conflicting or unconvincing explanations for injury. Emotional abuse is a pattern of behavior on the part of the parent or caregiver that results in impairment of the child's social, emotional, or intellectual functioning. Some indicators include extreme behaviors, delayed physical and emotional development, lack of attachment to the parent. So, emotional abuse may be suspected when the parent or other adult caregiver constantly blames or belittles or berates the child, is overly concerned about the child, and refuses to consider offers of help from the for the child's problem, overtly rejects the child. Physical neglect of a child includes refusing of or delaying a seeking health care, abandonment, expulsion from home, or refusal to allow a runaway to return home, inadequate supervision. Emotional neglect refers to a chronic failure by the parent or caregiver to provide the child with hope, love, and support necessary for the development of a sound, healthy personality. Behavioral indicators of neglect include if a child's frequently absent from school, if they're stealing food or begging for food and money, lacks medical, dental, immunization care, or the glasses that are necessary for learning, is consistently dirty or has a severe body odor, lacks sufficient clothing for the weather, abuses drugs and alcohol, or states no one's at home to provide care for them. Sexual abuse of a child. So that includes sexual exploitation of a child, incest. Indicators of sexual abuse may be difficulty walking or sitting, reports might be nightmares and bedwetting, experiences sudden change in appetite, demonstrates bizarre, sophisticated, or unusually sexual knowledge or behavior, becomes pregnant, or contracts a sexually transmitted disease. Characteristics of a child abuser. So, a number of factors have been associated with adults who abuse and neglect children. So, a parent who abuses their child were likely abused as children themselves. Some of the influences could be numerous stressors, poverty, social isolation, absence of adequate support systems, lack of knowledge of child development and child care. The incestuous relationship. So there's been studies done of father and daughter incest, and usually there is an impairment in the parents' sexual relationship. The father may be domineering, impulsive, physically abusive, when the mother may be passive, submissive, and denigrates her role of the wife and mother. Often the mother may be aware of the incest and denies it or decides to keep quiet about it. The adult that survives incest may lack pleasure with sexual activity. They may become promiscuous. They may also have a fundamental lack of trust that arises out of the unsatisfied parent child relationship. We have ourselves a question. A 12-year-old girl suddenly refuses to change for gym, participate in physical activity, has difficulty walking and sitting, and will not eat food at lunchtime. What should the school nurse consider when assessing the child's symptoms? A. Sexual abuse. B. Emotional neglect. C. Physical neglect. D. Emotional abuse. And I'll give you a second. And you are correct. The answer is A. Sexual abuse of a child may be considered a possibility when a child has difficulty walking, sitting, refuses to change for gym or to participate in activities, and reports nightmares, bedwetting, changes in appetite, or any type of bizarre, unusually sexual behavior. Sexual assault. So, rape is an act of aggression, not passion. It is the expression of power and dominance by means of sexual violence. Most commonly, men over women, although men have been victims of rape. So, this slide mentions three different types of rape. So, we have acquaintance rape. So, the rapist is acquainted with the victim or someone that they know. Then you have marital rape, which is recognized in recent years as a legal category when the spouse is held liable for sexual abuse of the marital partner. Then you have statutory rape. So, statutory rape is defined as unlawful intercourse between a person who is over the age of consent and a person who is under the age of consent. So, the legal age of consent varies from state to state, ranging from age of 14 to 18. I believe Pennsylvania may be the age of 16. Profiler of the victimizer. It is difficult to profile a rapist. Sadok and others identify four groups. So the first group is the sexual sadist. The second group is exploitive predators. The third group is inadequate men. And the fourth group is those displacing anger. So please refer to your textbook in reference to these four different types of victimizers. Sexual assault continued. The long term effect depends largely on the individual's ego strength, social support system, and treatment as a victim. So the victim response. In the expressed response pattern, the survivor expresses feelings of fear, anger, anxiety, um, and may have behaviors of crying, sobbing, restlessness, and tension. In the controlled response pattern, the feelings are masked or hidden, and a calm, composed, or subdued effect is seen. Some survivors develop a compound rape reaction in which additional symptoms such as depression and suicide, substance abuse, and even psychotic behaviors may be noted. Another variation has been called silent rape reaction, in which the survivor tells no one about the assault. Anxiety is suppressed, and the emotional burden may become overwhelming. The unresolved sexual trauma may not be revealed until the woman is forced to face another sexual crisis in her life that um, reactivates the previous unresolved feelings. So the next few slides we'll talk about the nursing process. So we have a nursing diagnosis and outcomes. Nursing diagnosis for a client who has been abused may include rape trauma syndrome, powerlessness, risks for delayed development. Outcome goal criteria are identified for measuring the effectiveness of the care plan or the nursing care. Planning and implementation. Goals for care of a victim of abuse should focus on treating the physical wounds, beginning healthy grief resolution, helping a client exhibit control over their life, and helping a client demonstrate behaviors consistent with age appropriate growth and development. So the nursing interventions for a victim of abuse and neglect are to provide shelter and promote reassurance for his or her safety. Planning and implementation continued. So some other concerns include tending to, or interventions include tending to physical injuries, staying with the client to provide security, assisting the client in recognizing options, promoting trust, reporting to authorities when there is a reason to suspect child abuse or neglect. Refer to Table 25-1 in your textbook in reference to interventions for our abuse victims. We have ourselves a question. A young mother in a severely abusive relationship is admitted to a psychiatric unit after attempting suicide. The client tells the nurse, I am sure things will be better between us once I go home. Which is the most appropriate response? A. Research shows that men who batter get worse rather than improve. B. Aren't you concerned about your children? C. You really should not return home to that violent situation. D. Let's develop a safety plan in, in case he becomes violent in the future. And I'll give you a minute. And you are correct. The answer is D. So the client must be aware of the different resources available to her. And safety is always the most important thing for our patients. We have ourselves another question. After examination and treatment for rape, the nurse prepares to discharge a client from the emergency department. Which discharge teaching should the nurse provide? A. Information on available community resources. B. The names and phone numbers of local attorneys to defend rape victims. C. When to return to the ED for follow-up care. D. The phone number of battered women's shelters and safe houses. I'll give you a second. And you are correct. The answer is A. A client must be made aware of the different resources that are available to her. This gives her a sense of power. Evaluation. Evaluation is based on accomplishments of the previously established outcome criteria. Treatment modalities. So first we have crisis intervention. So the focus is on the initial interview and follow up with a client who has been sexually assaulted. So the goal of crisis intervention is to help the survivor return to their previous lifestyle as quickly as possible. The safe house or shelter. So these shelters provide a variety of services, and women receive emotional support from staff and each other. And most shelters do have some type of counseling group, child care programs, legal representation, and helps the woman plan for her future and housing if needed. Then we have family therapy. So for family therapy, these therapy sessions are with all family members when all family members are together during these sessions. Focus on family communication. They encourage expression of honest feelings in a manner that is non-threatening to other family members. They encourage active listening, assertiveness techniques, and respect.